8,817 patients by vaccination status again. Those who are not fully vaccinated, 81.6%, the lion's share. And in terms of the deaths on the bottom, we see 3,183 plus the 390, the lion's share again. Over 93% of those who have died from COVID-19 in Trinidad and Tobago have not been fully vaccinated. We're looking at a breakdown in the hospital figures. Positive patients in hospital, 192, and those are spread among a few facilities: Couva Hospital and Multi-Training Facility, 58, 4 in the ICU, 4 in the high dependency unit. At Cora, 32 persons. Augustus Long Hospital, 40. St. Anne's Hospital, 5. Arima General Hospital, there are 14 persons. Point Fortin Area Hospital, 10. St. James Medical Complex, 21. Scarborough Regional Hospital at Fort King George, 11. And Scarborough General Hospital, Signal Hill, 1 person. There's no persons in the step-down facility at this time, and that brings me to the end of my brief clinical update for this morning.
And thank you very much, CMO. We welcome back Nurse Bettel to the media conference. Last year, Nurse Smith-Bettel shared her experience attending the COVID-19 patients in the ICU ward at the Couva Hospital. This morning, she's here to speak about a very important day in the health calendar, International Nurses Day. Nurse Bettel.
Thank you, Al. Good morning to the Honorable Terence Dial Singh, Dr. Roshan Parasram, members of the media, and to our viewing and listening public. I am Josette Smith-Bethel, a registered nurse attached to the intensive care unit at the Couva Hospital and Multi-Training Facility of the North Central Regional Health Authority. I'm grateful for yet another opportunity to represent the profession of nursing in Trinidad and Tobago, and today share with you the significance of International Nurses Day 2022. International Nurses Day is observed and celebrated each year on May 12th to mark the invaluable contributions that nurses have made and continue to make to the health of societies globally. The International Council of Nurses has celebrated International Nurses Day since 1965. This date is important to all nurses as it commemorates the birth of Florence Nightingale, who is known to us as the pioneer of modern nursing. Each year has a specific theme, and 2022 is without exception. Our theme this year, as sanctioned by the ICN, is Nurses, a voice to lead, invest in nursing and respect rights to secure global health. The COVID-19 pandemic has shown us only too clearly that we need real investment in the nursing profession in order to successfully secure global health. Even though we continue to work through challenging circumstances, nursing staff around the world and at home in Trinidad and Tobago continue to go above and beyond to deliver highly skilled, critical care to patients every day. We are an innovative and dynamic group of professionals, so much so that the year 2020 was declared the year of the nurse, but COVID-19 struck, halting all observances. Nevertheless, when the pandemic hit, we adjusted and answered the clarion call. The concept of investing in nurses is similar to that of investing in a business. One wants to know that it would be profitable and the benefits it brings would be sustainable in the future. Commitment, dedication, and willingness cannot be bought. However, by investing in our profession, every citizen, regardless of their socioeconomic status, will reap the benefits. During this pandemic, some investments have been made into the profession, and we are grateful to the Ministry of Health for several initiatives, including the accelerated program of the ICU course, which included nurses from the various regional health authorities being trained to operate several pieces of ICU equipment. We also acknowledge the North Central Regional Health Authority for the immense psychological support that aids in our work-life balance. Additionally, mention must be made to the other regions for their sterling contributions made during this pandemic by providing trained nurses to treat with the high acuity of COVID-19 patients. These initiatives have fostered camaraderie, enabling us to stand together as soldiers in this ongoing war against COVID-19. The responsibility of healthcare rests with the multidisciplinary team, which includes nurses. The professionalism demonstrated by the multidisciplinary team in both the primary and parallel healthcare systems continues to result in improved patient outcomes. Successful discharge planning and continuity of care depend on us nurses, who spend the majority of our time with patients implementing holistic care. We are the backbone of the healthcare system in Trinidad and Tobago. As one of the most trusted and respected health professions, nursing has an essential role in addressing the multiple health challenges that are being faced globally. We are the engine room of the health system and are required to respond to health needs of individuals, communities, and the world. Furthermore, with a crucial role as patients' advocates, our scientific reasoning skills and spectrum of care, we are ideally situated to lead and inform health services decision-making and policy development. Nursing is more than a job. It is a passion. It is a profession. Nursing is an art, and COVID-19 has brought public awareness to the contributions of nurses. The art of nursing exemplifies compassion, concern, commitment, and communication amongst many other non-technical skills. And these attributes have been evident in the many ways we have cared for our patients and their families. There is no health without a health workforce. Therefore, we as nurses must continue to do our research for improvement of patient care and the profession overall. This morning, I stand proud to be a member of this noble profession, and I salute my brothers and sisters who continue to live this profession up and provide care for those who cannot care for themselves. Moreover, as we continue to enjoy our week of festivities across Trinidad and Tobago, I take this opportunity to wish us all a happy International Nurses Day. Thank you.
And certainly a happy International Nurses Day to you, Nurse Bethel.
Thank you.
12th May 2022 International Nurses Day. The Honorable Terence Yalsing will close off this morning's presentation with the latest vaccination figures as well as an update on the current initiatives regarding the national COVID-19 vaccination campaign. Minister.
Thank you very much, Al. Good morning. Good morning, Dr. Parashram, and very good morning to our nursing representative this morning, Nurse Bethel, as we celebrate nurses around the world and recognize their efforts. Tomorrow is International Nurses Day. It is the day, May 12th of every year, which is used because it commemorates the birth of Florence Nightingale on May 12th, 1820. And it was Florence Nightingale and her experiences that she gained as a nurse during the Crimean War at that time that led her to develop policies and procedures for sanitation especially, and care for soldiers, and she became known as the Lady with the Lamp. So all nurses today, whilst they are not genetic descendants of Florence Nightingale, they are descendants of the ideals of Florence Nightingale. And we are proud to have you, Nurse Bethel, this morning, and we continue to give our thanks to all nurses in Trinidad and Tobago and throughout the world. The vaccination numbers this morning are: first dose, 691,020, basically stuck at 49.4%. Complete vaccination schedule, 711,769, again, still stuck at 50.8%. And those persons being boosted are 152,015. Let me bring you up to date. Oh, good morning, ladies and gentlemen of the media, sorry, and members of the public, wherever you are. Sorry about that. We had our final meeting with the officials from where we are getting the 5 to 11 vaccines, Pfizer, on Monday. So I think everything is now done and dusted. We are in discussions now, and about logistics again. And we should have something definitive to tell the public about an exact date of delivery, hopefully within the next 7 days. What we are doing in the meantime is preparing to make the distribution and administration of these vaccines to the 5 to 11 age group as easy and accessible as possible. So we are going to expand the number of sites outside of the MassVac sites. So it will be at the MassVac sites as usual, but we are also going to be expanding that at selected health centers, which will be published and made known by next week. So we are going to make accessibility and convenience even more accessible and more convenient. So we are working on that behind the scenes. The Pfizer booster for the 12 to 11 age group, 12 to 18. As you know, we started vaccinating those secondary school children, I think last year, September, somewhere around there. WHO has now signed off on the administration of boosters, Pfizer boosters for that age group. And our local technical advisory group under the chairmanship of the Chief Medical Officer, again, met on Monday, was it, CMO? Monday. And they have also signed off. I have informed the RHAs and so on. And we are going to start the booster program, Pfizer booster program for children between the ages of 12 to 18 from Friday. Our sites are being prepped. Just to let parents know, you need to come in with your kids, the usual parental consent, and the boosters will be available to those children who received their vaccines 6 months ago. So if you have received your second shot less than 6 months, please don't come in to get boosted. We urge parents and children in that 12 to 18 age group, especially those who are immunocompromised, whether you have diabetes, sickle cell anemia, cardiac disease, cancers, anything that predisposes you to being immunocompromised. If you are unsure, please speak with your pediatrician or family physician. Those boosters are highly recommended for those subpopulations of the 12 to 18. So let's get some of our 12 to 18s boosted. So I've dealt with the 5 to 11. We expect something within the next 7 days. We had our last meeting Monday. Dealt with the booster. The current regime of administering the Pfizer vaccines, as you know, these vaccines expire at the end of June of 2022. So we have set a cutoff date of 5th of June. Until that time, we'll be administering first doses. We have to stop at the 5th of June to allow 21 days so persons can get their second shot. So the Pfizer program for first shots only will stop on the 5th of June. Second doses and boosters will continue until the end of June, because that is the expiry date of the current stock that we have. So that is where we are at the current time with vaccinations. There have been some positive developments, and I have shared them with you. And Al, I think we can go to questions and answers.
Thank you very much, Minister. So up next is our question and answer segment. We ask the media representatives to state their name and the name of the media house before posing your questions. We are requesting a maximum of 2 questions per media house in the first instance, after which, as you know, we will field additional questions from the media representatives, of course, as time permits. We will take our first question from Guardia Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Both my questions are for Minister Diyal Singh. Minister Dial Singh, by chance, did you get any updated figures from the Ministry of Education on COVID-19 cases in schools? I know you gave us one last week. And secondly, Minister, are we still pursuing that whole digital vaccination card thing? I know it's a little bit less relevant now that safe zones have ended, but how do you feel as Minister of Health knowing that we haven't gotten that vaccination card as yet?
Thank you. Thank you, Richard. So on the issue of schools, I am expecting the numbers. I reached out to the Minister of Education this morning, and once they come in during the course of the press conference, I will share it. On the issue of the digital vaccination cards, the Minister of Digital Transformation gave an answer to this in the Senate a couple of weeks ago. What he indicated were, one, there were some serious data breaches on the international scene in December of 2021, which severely affected globally the whole issue of digital vaccinations. They are working on that. I think that issue has been resolved. We were also resolving the issue of data input. And as you rightly said, the issue of a digital vaccination card is one that is assuming less and less significance, but it is something that I think we should still pursue, and I am pursuing it with the Minister of Digital Transformation. Thank you very much.
Thank you very much, Minister. We go to TV6 for your questions.
Hi, good morning to the entire panel. Alicia Boucher from TV6 here. My first two questions are for the Minister. Minister, in light of the Pfizer booster rollout for the 12 to 18, would we need to reserve any of those Pfizer vaccines to boost that age group? I think it is about, 58,000 from that cohort was vaccinated. I may be wrong, it could be a little more than that, but would we be reserving their boosters? That's the first question. Second question is, a couple months ago, the Ministry of Health stated that the vaccination campaign was going to be shifted to meet, folks on the ground. Can we get an idea of what has been done so far to encourage parents of the 5 to 11 to get their children vaccinated when these vaccines actually do arrive in the country? Thank you so much.
Thank you, Alicia. Yeah. So even though so let me get you an exact figure for that 12 to 18. Yeah. So 12 to 18, 55,657. However, it doesn't mean all 55,000 are eligible to be boosted. It will be a percentage because you have to have been vaccinated 6 months and over. So yes, we are reserving some doses for that, and we have more than enough stock, and that is why also we have to stop the first doses. So yes. On the ground, on the issue of, so we have been doing a lot of education through the RHAs, asking people to get vaccinated. Unfortunately, as you know, the anti-vax movement is also very active, but we ask parents of that 5 to 11 cohort. We have a lot of data now on the efficacy and safety of the vaccines for that cohort. What happened, and one of the reasons why the 12 to 18 vaccine did not go as planned, is that social media and the anti-vaxxers will latch on to one issue and take advantage of the fact that many children and parents had anxiety when they were getting the vaccines and deliberate misconstrue that as cardiac events. And it is so sad how the anti-vaxxers movement will use social media to discourage people, discourage parents from getting vaccinated. Most of the events with the 12 to 18, and the CMO can probably bear me out here, he's free to give a was not due to cardiac events or pericarditis. There were one or two, I'm not saying there were none, but issues of anxiety which led to rapid breathing and so on, associated with getting the vaccine, not that the vaccine produced this. And this happened all around the world, but we continue to reach out to parents that the vaccines that you have been giving your children all through the years, yes, they will cry, yes. Don't over-exaggerate it when we start to do the rollout for the 5 to 11s. There will be anxiety. It doesn't mean the vaccine is causing it. It is just the psychology and anxiety that parents and children are going to feel. Okay? Thank you very much, Alicia.
And thank you, Minister. With that, we go to azpnews.com for your questions.
Hi, good morning. Suan Weil, ACP News. My two questions are also for the Minister, at least for now. Given the pediatric formula is about to arrive soon, hopefully, there is a suggestion that the vaccines be made available in the school system as has been done in previous years. Is this something that can be considered? And we know that there's no cost for the vaccines that will be arriving from Spain, but is there a cost for the preparation and administering of it here in Trinidad and Tobago? Thank you very much.
Thank you. So at this time, as I indicated, we'll be making the vaccines available at our mass vac sites and selected health centers to increase the distribution network. Because it is a younger cohort of children who may be anxious, we feel it is better to have it in a controlled setting where you have the necessary emergency response, because the last thing you want is for one parent or one child to have an event and you can't respond appropriately. So out of an abundance of caution, we are going to have it in physical locations where an emergency response, especially for anxiety, not because of the vaccine, but because of anxiety. On the issue of cost, these vaccines are a donation from the government of Spain. They are free to us, so there is no direct cost. Of course, with all vaccines that we administer, whether it's COVID or non-COVID, there are the indirect costs like syringes, paying for staff, and so on, right? So that is so the vaccines are actually free, but the normal administrative costs are going to be there.
Thanks for that clarification, Minister. And with that, we go to Newsday. Good morning.
Good morning, everyone. Rihanna McKenzie here from Newsday. My first question is for CMO Parasram or Minister Dialsing. Well, as we know, people are testing privately now. So just for clarification, those who test positively privately by their doctors, do they have to present the results to the ministry, to the health centers, and given a quarantine order? Or is it okay for them to be given a sick leave? Because my second question, in light of World Nurse Day, can we have an update on access to mental health services for nurses and frontline healthcare workers? And throughout the pandemic, I know the brunt of the burden would have been on them, and access to mental health services would have been a priority. Is this still continuing? And can you say how many nurses have been accessing these services? Thank you.
Yeah, so yes, thank you for raising the issue of mental health support. So both myself and Nurse Bethel will take that. So we prioritize the care of our healthcare professionals, including nurses, from day one, with the setting up of psychosocial support for nurses. Nurse Bethel, in her address, would have spoken about NCRHA especially, because that's where she's at. So I will hand you over to Nurse Bethel, who can give you a more practical experience.
In respect to mental health, the NCRHA has provided and continues to provide ongoing mental health support for all categories of staff throughout the NCRHA. We have psychologists, we have the mental health nurses who do their regular check-ins with us. We schedule appointments regularly to meet with them and to share whatever stressors we may be experiencing. In terms of how many nurses, I would safely say at the Couva Health Facility, the majority, if not all of us, have sought mental health assistance from the psychologists and the nurses that are available to us on a regular basis. So the process is ongoing, the help is there, and it is accessible for all of us, at least within the NCRHA, and I hope that the other health authorities would and are doing the same for their nurses.
Thank you very much. And with that, we go to TTT.
There's one question.
Oh, sorry.
Yeah, so in terms of your first question that you asked about positive cases, so we do get reports of positives from any health facility, any laboratory, family physician's office, to my office, as well as through the Trinidad Public Health Lab and the CMOH offices. Generally speaking, once you have a positive, even antigen or PCR at this point in time, although we recommend confirmation of your antigen positives, they are counted as positive that will be dealt with in terms of action by the CMOH. So a quarantine order is generally issued once you have a positive COVID test, especially with the symptomatology that goes along with it. I hope that answers the question, as opposed to a sick leave.
Richard, I got the response from Ministry of Education. Unfortunately, the Excel spreadsheet is not opening on my phone, but I'm trying to get it resent. So I do have it, but it's just not opening on my phone. So I will try during the course of this press conference to see if I could download it. Okay? Thank you.
Thanks, Minister. TTT, we are ready for your two questions. Good morning.
Yes. Hi, morning. Also, Lala from TTT News. Minister, I know you discussed about the 12 to 18 age group as it pertains to the boosters. Those who may have had COVID within that time, what is the length they would have to wait to get that booster? I think it's 6 months, or either 6 months or 3 months for adults. Anything as it pertains to this? And secondly, for me, we're still seeing daily deaths around 5, 4, 3 within the last few days and so on. Are people still calling too late to be hospitalized and so on?
Okay. So in terms of your question, the time is the same as for adults. So if you have an infection confirmed, then you wait 3 months post that infection and you can have your booster, or you could have your additional doses, as the case may be. In terms of what is happening with the deaths, our rolling average of deaths is actually standing at 3. Our case fatality rate has gone to 2.76. So generally speaking, the types of deaths we are seeing, and this is what is coming to us from the clinicians, are, to the most part, elderly persons with comorbidities, generally speaking, unvaccinated as well. Again, the numbers have gone down significantly. What we're seeing, which is interesting as well, is that you're seeing, in terms of hospitalization, the percentage of persons hospitalized based on the confirmed numbers has declined as well. So what used to happen, let us say in the Delta surge, when we had 18 to 24% of persons who were positive being hospitalized, meaning 18 to 24 persons for every 100 confirmed cases, which is quite a high number. You're seeing something like 3 persons to 6 persons for every 100 cases that you have being hospitalized or requiring hospitalization. So it is a combination of factors, generally the population level immunity from naturally acquired infection as well as from vaccination, combining to create a situation where we have a higher level of immunity, as well as you have a pathogen in the form of Omicron, which seems to be having a milder presentation, generally speaking, whether it is due to the population level immunity or a combination of factors, so that the hospitalizations are down and the deaths are down as well at the same time. Just to give you an example, if we would have had 576 cases in the time of Delta in a day, you would have had a much higher death rate based on the case fatality rate and based on the presentation of the disease itself. So that is more or less what we're seeing at this point in time.
Right. Richard, success. So let's go. Data by district. This is from the Ministry of Education. Data by district for the period 2nd May to 8th May 2022. So it's a bit long, but we will go it through step by step. It's broken down by district. In the Port of Spain district, the number of positive cases, 82. The number of schools with positive cases, 34. The number of schools where students were tested, 41. Northeast district, number of positive cases there, 19. Number of schools with cases, 11. Number of schools where students were tested, 17. Currently, number of positive cases, 44. Number of schools with cases, 24. Number of schools where students were tested, 29. St. Patrick, number of positive cases, 19. Number of schools with positive cases, 11. Number of schools where students were tested, 14. Victoria, number of positive cases, 44. Number of schools with positive cases, 25. Number of schools where students were tested, 28. Southeast, I suppose that is SE Southeast. Number of positive cases, 15. Number of schools with cases, 9. Number of schools where students were tested, 28. And lastly, SGE, that's probably St. George East. Yeah. Number of positive cases, 83. Number of schools with positive cases, 30. Number of schools where students were tested, 29. So I'll now give you the aggregate. The total number of positive cases for the period 2nd to 8th May, 306. The number of schools with positive cases in total, 144. And the number of schools where students were tested, 186. Okay? So I think that is the up-to-date information I have from the Ministry of Education. Okay, Richard? Thank you very much, my friend.
Thank you very much, Minister. And with that, we go to Astronet Health. We haven't heard from Astronet Health in a while. Welcome back.
Thank you, Gwyneth Stewart here. So I have a question of deep concern concerning the masks. There's a report of studies that viruses can accumulate in the fabric of the different types of masks. And there's evidence of bacterial pneumonia, microplastic pollution in the lungs from masks wearing, and even gum disease and dental cavities, and also masks worn by children in schools, bacterial colonies growing on the mask. So my question is, under what conditions is the mask, and this question is to CMO, under what conditions is the mask likely to cause harm or injury, and do the COVID public health regulations make provision for such eventualities?
All right, so generally speaking, the masks that we have been using in Trinidad and most of the world are masks that are disposable, first of all, so they shouldn't be reused. So like the mask that I am wearing is a surgical mask. It is usually meant to be worn for the best part of a day, and then you dispose of it. In that way, it will not be prone to, actually when you get it wet, so when there's moisture on it, after that you should dispose of it as well. So once it stays dry during the day, it is a disposable mask. You get rid of it after that. In terms of best practice, that's the way it should be worn. You have a new one. It is very unlikely that you will get the accumulation of viruses, or certainly not fungi or any other element on it. But it does, in terms of exposure to a person that has COVID-19, it will do its job, meaning that it tries to filter out that pathogen from getting into your lungs and into your system, and of course ultimately infecting you. Generally speaking, the provision as it relates to the public health regulation, it does allow for certain individuals and certain situations, for example, persons that cannot tolerate a mask, to wear a shield or other face covering your nose, mouth, and chin. So basically that will cover your persons who are exception for wearing a mask, but the masks are there to prevent infection for yourself and to prevent, if you are infected, spreading that to someone that you care about or someone in close proximity. And it is highly recommended, especially in light of this particular variant, which is usually quite transmissible, can be aerosolized, and usually spreads by respiratory droplet infection as well. So it is still highly recommended.
Thank you very much for that clarification, CMO. We go back to Guardian Media Limited for your follow-up question.
Hi, morning again, everyone. And Astronaut News, nice to see you back with us. Minister, I remember back in February, you would have indicated that we were down on some childhood vaccinations, MMR and yellow fever being well under herd immunity levels. And you indicated then that we were going to engage in some campaigns to bring that back up. Where do we stand now with those numbers? Do you know?
Yeah, thanks, Richard, and thanks for remembering that. I'm glad you have raised the issue. Yeah, so back then, we had identified CMO about 2,000 children, I believe, who we had to target for MMR across the various counties. So I remember that time saying that the numbers were not huge, but it is an area of concern. And the last update I had from Nurse Sukchan is that we have more or less closed that gap, because we did a lot of phone calling, we did a lot of convincing, we did a lot of on-the-ground work in communities. And the last information I had from Nurse Sukchan was that we basically closed the gap on those 2,000 who we had to get to take us back up to over 95%. So thanks very much for reminding me about that, Prashad.
Thank you very much, Minister. We go to azpnews.com for your follow-up question.
Hi, thanks again. My question is to Nurse Smith-Bethel. What challenges you and other nurses may continue to face on a regular basis, and how you all get around that? And by extension, you mentioned about investments. What more investments are needed to ensure more efficiency at the job at this point in time? Thank you.
Could you please repeat your first question?
Sure. My question is, what challenges you and other nurses may continue to face on a regular basis, and how you'll get around that, and by extension, what investments are needed to make the job more efficient at this point in time?
I would admit that the challenges are there, and the challenges are known. But at the Couva Health Facility, we have, for some reason or the other, we have found ways to deal with those challenges. We have recently formed an events committee that helps us de-stress, plan events that would help us not forget the workload, but take our minds off of it, and helps us cope better with each other and with the situations that we are faced. COVID is still ongoing. We still have patients to take care of. We still have our families to tend to. But along with the mental health support that we do have, it aids in our work-life balance. And that is one of the ways that we are currently dealing with it.
Thank you very much. And with that, we go to TV6 for your follow-up question.
Hi, good morning again. So I'm guessing between the minister and the CMO, you guys could take this one. I just wanted a little more information on the vaccines for the 5 to 11 in terms of the storage of these particular Pfizer vaccines. Are they the same for the Pfizer for adults? Would the observation time for the 5 to 11 be the same as it was for the adults? And did we have to do any kind of specific training in relation to the administration of these vaccines for the 5 to 11? Thank you.
Yeah, thanks. Thanks, Alicia. So the administration and storage of the 5 to 11 vaccines are basically identical to the adult version. So that isn't going to change. So there's no change as far as storage is concerned. I believe it's 2 to 8 degrees.
It can be stored for 2 to 8, for 10 weeks.
2 to 8 degrees. And the CMO will now go into the clinical part about observation and so on.
Yeah, so generally speaking, it is the same vaccine. It is a smaller dose because it's a younger age group. You tend to have people being much lighter in that age group. So it's by weight you tend to give vaccination. So it's a 0.2 ml dose as opposed to a 0.3. It requires mixing at the site of administration. So you mix it with a diluent and then you administer. It can be stored at 2 to 8 for about 10 weeks in this particular preparation. So normal refrigeration, once it thaws from the -70, it can actually be stored for 10 weeks at the 2 to 8, which is extremely good. And really, it is more or less the same. The nurses have been prepped and trained accordingly. So that the last part was what?
It was training.
Yeah. So basically, the training has been taken care of. The staff that would have been administering the 12 to 18 and the adult doses are well trained, and it's a small tweak in terms of the dosing that is required. In terms of the time for looking at the kids after, we had gone down to about 15 to 20 minutes observation time, and that is just to look for immediate side effects, things like what Minister had alluded to before. We see a lot of anxiety-related symptoms in the children. Generally speaking, you see some fainting, which is normal for vaccination. So we need to observe them for that particular period of time before we discharge them from the health facilities.
Thank you very much, CMO. Guardian Media Limited, we come back to you for a follow-up question.
Thank you. Before I ask this question, Minister, I just want to clarify your answer to my previous question about the MMR and the yellow fever vaccines. Is it that we were able to close the gap for both the MMR and the yellow fever, or was it just the MMR one? But my actual question is, what became of that mass storage site for COVID-19 fatalities, considering now that we're not seeing the numbers that we were seeing back then when that was underway?
Yeah, thanks, Rashad. So I think Nurse Sukchan alerted me that we have closed the gap for MMR and also yellow fever. But I think, Rashad, just to be on the safe side, I will double check that and get a more accurate answer for you next week in terms of numbers. Right. On the issue of mass storage site, that was an initiative of the Funeral Homes Association when we had those 30 and 40 unfortunate deaths per day. I don't believe that they are pursuing that again. There's probably no need to pursue that particular initiative again on their part. Thank you very much.
Thanks, Minister. azpnews.com, we're ready for your follow-up question.
Hi, thanks. Just wanted some further information with respect to my questions to Ms. Smith-Bethel just now. I had asked about investments to enhance efficiency in the profession. What can you say is needed at this point in time, and perhaps things that can be looked at for the medium and long term? Thank you.
For further investment into the profession, we need to invest in our own. We need to explore international standards, best world practices, but that responsibility solely lies on the government, the RHAs, the CEOs, the leaders. That I know that nurses have a role to play in it, but it solely lies on the policy makers, and we hope that they use the initiative to examine, to revise, and hopefully implement the changes and make the necessary investments needed to secure global health and improve the quality of healthcare in Trinidad and Tobago.
Yeah, thanks. If I may come in here, when Ms. Nurse Bethel was making her presentation, a particular initiative that I became involved in very early in my tenure, which was derailed for 2 years because of COVID, was rationalization of the education syllabi across the different schools for nursing. I am happy to report that Nurse Betty Ann Pilgrim, who was charged with that, has finished that document, as Nurse Bethel would have said in her presentation. And that is a serious intervention and investment in their training to have a more cohesive syllabus. So that and that was a result of a lot of stakeholder consultation over a period of years. So that will go now to the decision makers to see how we could implement that to significantly enhance even more the quality of the nurses we get in our system. Thank you very much.
Thank you very much, Minister. TV6, you have a question?
Yes, I do. Minister, I know we had numbers for NCDs pre-COVID-19, and I was wondering, as we move towards an endemic stage of COVID-19, so we're more once again refocusing on these other elements, are we seeing a rise in NCDs in the country? If so, do we have statistics to say by how much? And where is the NCD unit right now in terms of developing a plan to deal with this NCD epidemic? Thank you.
Thank you very much, Alicia. So I'm going to talk and get into my iPad here at the same time. So the NC unit has been established. It's up and working. We had a follow-up meeting with them on Monday, was it, CMO? You were there. So I'm going to actually into the PowerPoint update that was given. But let me share with you what we are doing. We started our outreaches back again, especially at NCRHA, the last 2 weekends, and I'm compiling the data now. What we are noticing, as we always do, is the high number of persons presenting with unknown hypertension, unknown diabetes, and so on. So some of the data that we have collected so far, from literature and desk reviews, the situation analysis shows that NCDs account for 62% of deaths annually. By condition, the leading causes are heart disease, 25%, diabetes, 17%, cancers, 17%, and stroke, 9%. Through a survey done in 2012, which we are updating, it's called the PAHO STEPS report, the prevalence at that time of hypertension was about 26.7%. We are calculating the prevalence of diabetes at this point in time. But let's look at things like smoking. Prevalence of smoking at that time, 21.1%, which is high. Prevalence of drinkers, 40.4%. And this to me is another frightening statistic. Prevalence of those not eating less than 5 servings of fruits and vegetables a day, 91%. Let's just focus on that. 91% of the population of 1.4 million is not eating enough fresh fruits and vegetables. And from that, when you consider inactivity, people not walking, children playing video games, all the fast foods we consume, all the soft drinks we consume, all of these things are what we are working on. So actually, I'm in one of the hospitals this afternoon because they presented a paper to me about stroke. And we are looking at all these pain points, whether it's stroke, amputations. We're going to have a very big symposium on amputations very soon, to try, once again, to get people to do 3 simple things. And we had launched this at the Sangre Grande Enhanced Health Center a couple of weeks ago. And you will see it. We are rebranding our hospitals as healthy zones. And you will see massive communication messages about drinking more water, eating more fruits and vegetables, and getting active. So these are some of the statistics that we have coming out of this. We are paying particular attention to our diabetes clinics, diabetes foot disease across the RHAs, and we are collecting all that data now. And what we are doing, some of the strategic objectives coming out of the unit, and they have done a lot of work since March to now. And we spoke about it yesterday. Approval of standardized clinical guidelines for the treatment of diabetes. We must have standardized clinical guidelines. Same thing, standardized clinical guidelines for the treatment of hypertension. And one of the issues we spoke about yesterday that these clinical guidelines will help us solve is the issue of polypharmacy. What is polypharmacy? Polypharmacy is when you have a patient in a hospital and you put them on 15 drugs. 5 for diabetes, 5 for hypertension, 5 for this. And polypharmacy, the recent data is showing, is something we need to move away from. Because one drug produces side effect A, the other one produces side effect B. This drug, so we are, and this can only be done by standardized clinical guidelines, which we are working on now. All of this was slowed down by COVID. We also want to have standardized clinical guidelines for the treatment of cardiovascular disease. Approval of standardized clinical guidelines for treatment of cancers, especially those main cancers: breast cancer, colorectal cancer, prostate cancer, cervical cancer, and lung cancer. So these are just some of the initiatives we are working on. But before we get there, we have to understand the numbers. So I've given you some of the numbers that are available, prevalence rates, and that is how we are going to start to tackle this, by understanding the numbers, getting the clinical guidelines going, and appealing to the population to change their lifestyles. Okay? Thank you very much.
All right, thank you very much. And we'll just close off with Guardian Media Limited. Guardian Media. I think they're waiting for...
All right, thanks. I was just waiting to be unmuted there.
Yes.
Okay, so this one is a question that came in from a member of the public, and I think it might be CMO would be able to answer that. They want to know when surgeries at the radiology department at Eric Williams will resume, because they've been told since COVID-19 they stopped and have not resumed, and there's a backlog.
So, Rashad, just let us have a conversation with the CEO of North Central, and then we could probably get that information back out to you. All right?
So, Rashad, again, what we always advise when you have these inquiries from members of the public, we will never be able to answer about a specific patient. And we always ask members of the media, as soon as they get it, send it to AL, send it to Corpcom, so we could contact the patient and understand their circumstance and try to assist them. What COVID-19 did around the world was that we had to suspend certain non-elective surgeries. We made that known, and we have started back. But if you have a particular patient with a particular concern, we want to help them. So send the information, just send their name and number to Al, and we will be sure to find out the circumstances of this particular patient, and we are committed to assisting. Thank you very much.
We'd like to thank the media for your questions. In closing, we ask that you please continue to protect yourself and your loved ones. The virus is still among us. And remember, COVID-19 vaccines are available in all 5 regional health authorities and at all 109 public health centers, in addition to the advertised vaccination sites. So if you have not received your COVID-19 vaccination as yet, or are due for your booster, please get yours now. Please continue to follow us at health.gov.tt or on our social media pages for accurate and up-to-date information. And to all our nurses, past and present, we appreciate the amazing work that you have done and continue to do to ensure a healthier Trinidad and Tobago. Do have a happy International Nurses Day. Goodbye for now.
Here are your COVID-19 isolation tips: protecting others while in quarantine or self-isolation. While in quarantine or self-isolation, use safety measures to protect yourself and community.